welcome to the Guyana Health Literacy Program. This program is a series of videos created just for you by healthcare providers about important healthcare topics. Life is like an adventure full of trials and challenges. Consider these videos your map and your healthcare provider your guide on a path to a healthier life. By making small, healthy changes and seeing your healthcare provider regularly, you can set yourself up on a path to a happier, healthier life.
Each video in this series is a 5 to 10 minute clip about an important health topic. Please talk to your doctor or healthcare provider if any of these topics relate to you or your family. Together, we can form a happier, healthier community. So please sit back, relax, buckle up as we go on our journey to a happier, healthier you.
Hi, I'm Dr. V, and welcome to this segment on Tobacco and Smoking 101. Today I have Drs. Intichai and Dr. Singh who will be joining me as we talk about this very important topic. So welcome, guys.
Hi, Dr. V. I'm Dr. Intichai.
Hi, Dr. V. I'm Dr. Singh. Thank you for letting us join you.
Absolutely. It's great that you guys are here. So why don't we get started? Before we kind of dive into the topic, we're going to go over some very important facts about tobacco and smoking. So smoking is essentially in its various forms. The most common forms that most people know about is within your cigarettes, but there's also these new forms like vaping. All of these essentially lead to disease and a lot of disability that we're all very aware of, and this pretty much affects all the organs in our body. Nearly 60 million Americans actually live with the diseases associated with smoking. That's a large number, right, guys?
Yes, that is absolutely true. Smoking causes a wide range of diseases, including different cancers, heart disease, cholesterol, causes diabetes, and lung disease, such as chronic bronchitis.
It also increases the risk of eye problems, tuberculosis, erectile dysfunction, as well as increase in aging appearance as well.
Right. But despite all the negative things that we're telling you about associated with smoking, a lot of these things are actually preventable, and we can really break the cycle of addiction and the associated outcomes.
Yeah, because tobacco smoking costs about 7 million deaths per year. In addition, it costs about $170 billion in medical care.
Yes, and Dr. Intichai, I wanted to add to that, that there is a lot of investment into helping people quit and to decrease the economic and personal impact of smoking.
So what are some of the things that we as doctors can really help our patients to kind of help them quit?
So there's a lot of tools that we have that can help patients quit smoking. There are 3 medications that have been approved for smoking cessation, and that is nicotine replacement therapy, Wellbutrin, and Chantix. Nicotine replacement therapy specifically is aimed at decreasing your craving and reducing the symptoms of nicotine withdrawal.
And these also comes in forms gum, inhaler, lozenges, and oral spray form.
That's really cool. I don't think a lot of these patients might actually know about that. But despite all these medications and things that your physicians can provide you, there are a lot of additional resources that they can help you out with as well. You know, things like relaxation techniques, perhaps meditation, and so on. They're all going to be part of helping you quit.
So what are the health benefits that are associated with smoking cessation?
There's quite a lot actually, Dr. Singh. It decreases your blood pressure, decreases the risk of cancer, lung disease, stroke, and also improves circulation as well.
Very nice. But I think in general, like, it's really hard for a lot of people to quit because your body essentially becomes dependent on nicotine. But there are a lot of things that you essentially can do to help yourself in the process. Meditation, deep breathing techniques, perhaps learning how to handle your stress, or maybe even finding new hobbies that will distract you from smoking.
Definitely. And if you start smoking again after you quit, don't give up, because you want to start thinking about yourself in a positive way and things about the things that help you in the first place.
And don't forget, you can always reach out to a local physician to help you in the process as well.
Okay, guys. Well, that concludes our segment. Thank you all for joining us, and basically come back next time for a new segment on your health and well-being. Thank you, guys. Bye. Bye.
Good morning, Ms. Rodriguez. It's so nice to see you again. I hear that you're here for your annual visit?
Yes, I am. And I was told I needed a pap smear. Can you tell me more about that?
Yes, now that you've turned 21, it's time to go ahead and do your pap smear to screen for cervical cancer.
Okay. So what is cervical cancer?
Well, cervical cancer is a cancer, which is a group of abnormally growing cells that's located on the cervix. Now, the cervix is the entrance to the soft tissue path that connects the vagina to the womb. That is the area that we examine when we do a pap smear.
Okay, so how do you exactly do a pap smear?
Well, the first thing we'll have you do is lay flat on a bed, and the patient will place their feet in the stirrups. The physician will then insert a speculum into the vagina to visualize the cervix. Next, they use a small spatula or brush to gently brush the outside of the cervix, collecting a few cells. Those cells are then examined under a microscope to see if they're normal.
Okay, that makes sense. So what happens if I have abnormal cells? Does that mean I have cancer?
Not necessarily. If your cells are abnormal, they'll then be staged or ranked somewhere between normal and cervical cancer. Your doctor will review your test results with you and recommend treatment based on those results. In most cases, the atypical cells can be removed long before they become cancerous.
Okay. So what causes this cancer?
Well, most cervical cancer is actually caused by a virus called human papillomavirus, or HPV. Almost everyone will be exposed to this virus at some point in their life. Many people have it and never know they have it, and it goes away on its own. But in some people, the virus will remain and cause cells to change. Now, if we're able to catch that change early with a pap smear, we can easily remove those bad cells long before they become cancerous.
So who needs to be tested for this?
Well, screening is recommended in women aged 21 to 35 every 3 years. And then in women aged 35 to 65, we can go ahead and stretch that to every 5 years, as long as they have a negative HPV test at the same time. It's really important to talk with your doctor, though, about your risk factors, because your doctor is going to help you decide how often you need to be screened.
Okay, so I'm curious. How would I know if I have cervical cancer?
Well, signs and symptoms of advanced cervical cancer can include vaginal bleeding after intercourse, in between periods, or after menopause. You can also have a bloody, watery discharge that can have a heavy or foul odor, as well as pelvic pain or pain with intercourse. Now, most cervical cancer actually has no signs or symptoms at all, which is why it's so important to make sure you have regular pap smears.
Awesome. So what I would like to know is, what else can I do about it? How can I prevent it?
So there is one way to go ahead and prevent cervical cancer. We now have a vaccine available for both men and women that protects against the worst types of HPV that cause cervical cancer. If you or some of your friends have not had the HPV vaccine, it's really important to ask your doctor if you might be a good candidate. You still need to have a regular routine pap smear, but the HPV vaccine is a great way to reduce your risk.
Wait, you said a vaccine. I thought the vaccine was only for kids. Am I still a candidate?
While we do go ahead and give the vaccine normally to kids on 2 or 3 different visits, it is recommended for men and women up to the age of 26, so you absolutely qualify.
Awesome. Thank you for this information. I definitely want to get a pap and I want to get the vaccine.
Wonderful. Let's go ahead and do your pap smear today, and we'll get you started with the first shot of the HPV vaccine. I just want to thank you for taking the time to come in today and help protect yourself against cervical cancer.
Thanks. Thank you very much.
Hi, Ms. Smith. I'm Dr. Jones. I'm happy to see you today.
Nice to see you too, Dr. Jones.
Ms. Smith, I want to talk to you today about your blood pressure.
Okay.
I'm concerned because for the last 2 visits, your blood pressure has been high.
A doctor told me a long time ago that my blood pressure was high and they put me on a medication. And then after a while, my blood pressure, they said, was fine, so I just stopped taking the medication.
Well, we use blood pressure medicine to control your blood pressure. When people with high blood pressure take the medicine every day as it's prescribed, their blood pressure usually goes down, but that doesn't mean the disease is cured. When they stop taking their blood pressure medicine, their blood pressure usually goes right back up.
I guess I didn't understand that. Can you tell me a little bit more about high blood pressure?
Sure. Blood pressure is a measure of the pressure inside your arteries, the blood vessels that carry blood away from your heart.
So when the nurse took my blood pressure, there was 2 numbers. Can you tell me why there's 2 numbers and not just 1?
Yes, we look at 2 numbers when we talk about blood pressure. The first, the one on top, is the pressure inside your arteries when your heart is squeezing. The second, the one on the bottom, is the pressure inside your arteries when your heart is relaxed. Our goal is to have the top number below 120 and the bottom number below 80. Elevations in either one or both can be trouble.
So is my blood pressure too high now?
Yes, your top value is above 140. When your top value is too high, it means that your heart is having to work too hard to push your blood through your arteries.
But I don't really feel sick right now.
High blood pressure usually doesn't have any symptoms at all, but we know that high blood pressure increases your risk for heart disease and stroke. That's why it's important to control your blood pressure and bring it back into the normal range.
Oh, so why did this happen?
It can happen because your arteries are stiff. Stiff arteries don't flex as well, and the pressure inside them gets higher. It can also happen if your blood vessels are very narrow. Your body makes signaling chemicals that cause small blood vessels in your body to get more narrow. Just like putting your thumb over the end of a hose increases pressure, it makes the water spray out farther. Narrow blood vessels raise your blood pressure too.
Okay, it sounds like there's a lot that I can do to lower my blood pressure, and there's some things I'm doing that increase my blood pressure. So what can I do to lower that blood pressure?
Well, one of the best things that you can do to reduce your blood pressure is to lose weight. If you smoke, you should stop smoking. Exercising for 30 minutes a day can also help to reduce your blood pressure. Eating a diet that's low in salt can help some people lower their blood pressure. Most of all, if you're prescribed medicine to take, it's important that you take it every day as prescribed.
Do I have to take the medicine forever?
Many people find that they need medication to keep their blood pressure under control, but if you make changes to your lifestyle and lose weight, as we talked about, you may not need to take as much blood pressure medicine. Some people are able to stop taking medication altogether, but that's a decision that you need to make in partnership with your doctor. Never stop taking a medication on your own without talking to your doctor first.
Okay, doctor, I think I understand. Thank you so much.
You're welcome.